All right, so Air Force brat, if that's the proper terminology, or is that
Yes, it is.
Okay.
It is.
So you said 6 places you grew up, starting from birth to Indiana, I guess?
Yeah, I think it's 6. So I was born in Grand Forks, North Dakota, actually. Okay. Grand Forks Air Force Base.
That is very trippy because my youngest daughter went to go visit the University of North Dakota.
Okay.
And their softball program.
I know nothing about North Dakota.
There you go. Other than you were born there.
My dad launched missiles there because that's, I think, what you do in North Dakota. Yep. And I then moved to Vandenberg Air Force Base in California for a couple years. Then I moved to Fort Worth, Texas, and then Seattle, Washington, actually Kent, Washington, and then Dayton, Ohio, Beaver Creek, Ohio, and then popped over to Indianapolis for college at Butler.
There you go.
Nice.
And I assume you went to Butler due to the pharmacy school there?
I did. Even though there are a lot of pharmacy schools in Ohio, I came over to Indianapolis for Butler.
So another random, what I like to call butt fact, is my uncle, who has been passed away for several years, he was in the first graduating class, pharmacy class at Butler.
Oh, really?
Oh, that's so cool.
Isn't that wild? Yeah. That was back when you could actually have like your own corner pharmacy store that wasn't all just CVS and Walgreens. And
sure. Yeah. That's really cool.
Yeah. Anyway,
of those 6, and some obviously you don't necessarily maybe remember as much as other, was there one that stands out as your favorite place?
Seattle, hands down. Still my happy place, going to Seattle. It just feels like, sometimes I get the same kind of feeling when I go into Whole Foods, when everybody's like, everybody's just being super kind.
Mm-hmm. Yeah.
That's kind of what it feels like when I go to Seattle. And surely there are unkind people in Seattle, but I just kind of feel that way when I go to Seattle.
Yep.
Yeah. My favorite.
So, okay, on that note, if you're in Seattle, what's your favorite spot to go? I've been to Seattle quite a bit, so I'm trying to see if they match up.
I'm gonna say such a cliche answer, but it's actually like a spot. So Pike Place Market, but in the flower section, the flowers are always so pretty, the bouquets of flowers and everything. So that, like, standing at the flower bouquet section at Pike Place Market is my favorite.
Right after you avoided the flying fish when you're coming in by the pig, and you take a right, and then you get there.
Right.
Yeah, yep. I know exactly what you're talking about.
The gum wall grows.
Yeah, just
right.
I like that better the day after they pressure wash it and get rid of all of it, and they have to start over again. Otherwise, I avoid it.
Yeah, I this last time we took, I'm not the name of the place is gonna escape me, but it's supposedly the birthplace of pickleball.
Really?
I have not visited that yet. I will have to.
You have to take a ferry.
Okay.
You take a ferry to it.
All right.
And if I remember, I'll blurt it out. But it's supposedly the birthplace of pickleball.
Okay, I'm actually flying on Monday to Seattle to go to. Well, we have an office in Olympia area, so maybe if I have time, maybe I'll try and find that ferry and go there. So.
Please do.
And we'll be back.
We'll be back in October. We can add that to the tour stop.
Yeah.
So,
I mean, the ferry we just wanted to ride a boat somewhere, and so we just got on the ferry. So
okay, all right. I'm gonna have to do some.
We don't know where this ferry is going, but we're getting.
It'll be fun either way. It's a happy place. Right. Nothing can go wrong.
Is this thing on? Hey guys, welcome back to another episode of the Summits Podcast. Thank all of you guys for joining us from wherever you get your podcast, or if you're joining us on the Heroes Foundation YouTube channel, thank you for tuning in. While you're there, if you hadn't hit the subscribe button, please do so. You don't have to get on a ferry to do it. Just hit that little subscribe button. Also, the little notification bell icon, hit that so you can be alerted when new episodes like this one drop. We'd appreciate it. All right. Heroes Foundation supporter and cancer survivor, which we will get into her story very soon, Dr. Jasmine Gonzalvo. Jasmine, welcome to the Summits Podcast.
Great to be here. Thanks for having me.
You're welcome. Thank you for joining us. You are the clinical professor of pharmacy practice at the Purdue University.
I don't know that there's a the.
Well, it's the Purdue University, to my knowledge.
All right, we'll take it.
Anyway, Jasmine, if you would, why don't you give us and our listeners and viewers a little background intro on yourself?
Sure. Yeah. So I wear a lot of hats. So many people do. I didn't know that my journey was going to take me where it was. At Butler, I was a terrible student. I got terrible grades and I just kind of tripped my way through pharmacy school, but graduated, then found myself working for Purdue, offered me a job, and I was so lucky to get an assistant professor job in the College of Pharmacy at Purdue, and have been there for my whole 18-year career. And I also practice clinically at Eskenazi, where I see patients that have high cardiometabolic risk, so a lot of diabetes, high blood pressure, and I actually optimize medications for people with high cardiometabolic risk. So that's sort of the clinical hat that I wear. I also, within the last 5 years, took on the role as the director of the Center for Health Excellence, Quality, and Innovation. And so actually, we work a lot out of central Indianapolis versus the West Lafayette area. And so I do a lot of work with some community partners like Gleaners Food Bank, St. Vincent de Paul, their food bank, and just set up a charitable pharmacy on site at the Southside Gleaners location. So I'm doing a lot of community-based work in Indianapolis, actually, for Purdue, but also pop up to West Lafayette to teach there as well.
Nice. You completely lost me when you said you skated through Butler Pharmacy, because I'm not a pharmacy. I was not a pharmacy major, but I know that is not an easy major. Like, how does someone just skate through per se?
No. I believe I said I tripped through it.
Tripped through. Sorry.
Yeah.
So
different motion.
It's a big difference, right? So skating, surely other people skated through it. Tripping through it is hanging on by the skin of my teeth, barely making it, calling my mom every weekend, being like, I don't know if I can do it. But then I did. I stuck with it and couldn't be happier with where I am now.
It's farther than I would have gotten in pharmacy. That's for sure. Yeah. So perseverance seems to have prevailed there for sure.
Yeah. Yes, for sure.
So of all the hats that you wear today, what do you find the most challenging and the most rewarding?
Oh, good question. It's so, I find myself at the point I am in my career, I don't know where I'm at in my career, but 18 years,
you're only
wherever
like 32,
that is.
so you're still early.
Right. I started my career when I was like 6. Yes. So I would say, honestly, I can go back and forth from most fulfilling and most challenging, like within minutes of it, even in a meeting, right? So for example, I find myself in situations a lot of times these days of like, Jasmine, would you like to lead this project? And I'm like, yes. And I have no idea how to do that. Right. And so, but I love it. I love a new challenge. I love supporting the Indianapolis community in the ways that I have. And I just have to do a lot of figuring stuff out. But sometimes when you're just the right person in the right time and the right place, you can't turn down an opportunity. And I have 2 daughters. They're 12 and 9, Polly and Araceli. And I kind of want them to see their mom doing those types of things, right? Of like, kind of stepping into an uncomfortable role, but excelling and succeeding and just looking forward to challenges and not shying away from them.
Yep. Getting comfortable, getting uncomfortable is huge. And I mean, I don't care whether you're 12 and 8 or whatever your kids' ages were to, I'm probably the oldest one here at 52. Like it can be a challenge at any level, but it's something that we all kind of need to get into for sure. I'm kind of stoked to hear you say that. And the fact that you like wearing multiple hats, I mean, certainly has its days, right?
Yeah.
But I find myself on occasion wishing I wasn't so that way, but at the same time, continue to do it. So it's like, okay, I can't get mad at myself because I keep putting myself in this position.
You keep putting a new hat back on. Yeah.
Yeah.
Yes. Yep. You have hats on your desk right now.
Yeah. Well,
it was foreshadowing. We knew this was coming up, so we had them
Speaking
propped
of hats.
here. Yeah.
So as a pharmacist and doctor of pharmacy, but working with community-based organizations, where do you feel like you kind of lend yourself most to those?
I think general public as a whole don't have a real great understanding of what pharmacists really are capable of and the places that pharmacists are. I think most people, and through no fault of their own, this isn't a negative thing, but when they think pharmacists, they think of CVS, Walgreens pharmacists, right. Walmart, and counting pills, and that's not at all. The only pills I see are the ones that I take, right? So as a pharmacist, it's really cool the things that I've had the opportunity to do. I work alongside physicians in a clinic, and I manage and change medications to make sure people are on the right medication. So that one is probably my most pharmacist-y job, but the rest of my responsibilities are really more in the public health space. This past May, I graduated from Harvard. I like to say it because it was hard.
Yeah.
La-di-da.
Yeah. All right.
Are we fancy all of a sudden?
Anytime you say it, it sounds pretentious. I don't know how to get around it.
I think that's by design, though. I think that you know what I mean? Like that they want that. So congrats.
Okay.
Congrats.
Yes. Well, now that it's out there,
yep.
I graduated from Harvard in May with my master's in public health.
Awesome.
I couldn't help myself. I just, when I found myself in spaces working with food banks, homeless shelters, I just felt like I would benefit from more of a public health approach. Mm-hmm. And so that pairs with sort of my medication access expertise and whatnot. And so I as a pharmacist, I feel like it's my responsibility not only to optimize and educate about medications, but also to make sure that there's access. I can educate all day, but if you can't get your medications, then that's a huge problem. And so through my clinical work and working with patients, I've always had to jump through a million hoops to make sure that people get access to their medications. But now it's more from a public health lens of how do we do this for a whole community, for a whole population across the city, for people who have the most barriers. I think I just found myself naturally gravitating towards that space because as a pharmacist, that's something we have to do. And it's not a space that a lot of people know how to navigate. Some people stop taking their medications when they come across a medication barrier, and it's just not okay. So that's how I found myself in that space and more of a public health setting and working alongside communities.
Good on you for doing that. That's awesome. I need to connect her with my sister. My sister is an MD, but focuses on public health. I believe she also has a master's in public health. I can't recall which school from. But she has spent her time as an OBGYN working on women's public health, typically in third world countries that have obstacles for women's health. And so I think you guys would pick up.
Is she in Indiana?
She's not. She's now in South Africa. She's moved around the world quite a bit, she and her husband, but that's another conversation for another day. But
another day.
Yeah. Yep. Anyway. So here's a random question. You said a lot of the clinical stuff you do is in the cardiovascular health side. Based on your personal experience with cancer and kind of the way we know cancer treatments are starting to head, do you find yourself looking at all in terms of, okay, if I take my drug knowledge and background and look at the oncology space and what they're doing there with, okay, it's not just anybody who gets this diagnosis automatically getting this, chemotherapy regimen. Now it's like, all right, let's look at that person and find, maybe these 3 or 4 drugs that were the classic cocktail of the last 15 to 20 years, while they've been semi-successful, now there's new medicines, or this person is better apt at taking these 2 and then this immunotherapy drug, and finding the right cocktail for the right person. Have you delved into that at all, or is that just not in your space? And so...
Not in my space.
Yeah.
So it's, but I know a lot of people in that space.
Sure.
But, it was funny when I was diagnosed right around that time. I had an oncologist that made a comment to me kind of similar, like, oh, you know what I'm talking about, with whatever medication that she was talking about. And I was like, actually, I have no idea. And so I really am squarely in the cardiometabolic space. And I do know what you're talking about in terms of what's happening in terms of like precision medicine and really tailoring people's oncology medications to their specific situation, their genetic makeup, and all those things. I wish I knew more about it, but I actually don't.
Okay, fair enough. Strike that question.
Yeah. Swing and a miss.
So, okay, let me ask you this again. And I'm not in the medical field, so if any of these are dumb questions, you could say you're an idiot. But I've heard it before from other people. Do you find pointed. Are you guys doing something similar though in the cardiac space? I mean, is precision medicine finding its way across the spectrum?
Yes. That I can envision a day in the future when, you know, you have your tailored medication cocktail to whatever your DNA says that you should have, maybe even before you have it. I mean, that's pretty cool. And again, something I don't know a ton about, but I do see a lot of different sectors moving in that direction.
Yeah. I think with what we know today, then now you start throwing AI at it, and then just all that starting to work together, it's going to accelerate rather rapidly, which
absolutely
on one hand's really cool, on the other hand's like, holy crap, that's kind of scary.
Yeah. Yeah.
Yes. Yeah.
And hopefully everything
keeping up with that.
Well, yeah, keeping up with it, and then hopefully everything that actually, and this is where you kind of come in. If I say this wrong, correct me, but everything that goes into the computer, hopefully what it spits out is accurate. It's not like pulling from random BS data that.
Yep. Or making it up.
Or yeah, hopefully not.
Yep.
Yeah. No comment. Now we have gone into territory where I don't even want to touch it.
Fair.
I asked what medication I should take, and it said jelly beans. Is that accurate?
Yep.
Okay.
Yeah, it is. Yeah. ChatGPT said it is.
I'm in.
So be it.
Now, if it said plate M&Ms, I'm like, oh, for sure.
Yeah.
We're golden. That is good to go.
Directly
M&Ms and red wine.
Yeah.
It knows me.
They said it, folks, not me.
Yeah, right.
Yes,
Yeah,
correct.
yeah.
Yes.
The non-professional.
All right, Jasmine. Here, this is the part of the program where we get down into it. Jasmine, what is your cancer story?
My cancer story actually starts in the heart of the pandemic. Actually, of all places to start. So it was December. Gosh, wow, the years just got confused in my head. I think it was December 2019. So December 6th, 2019. I was concerned about, I had like blood on my nightshirt when I woke up. And that's not normal. And so 3 days later, I pop into my doctor, and he says, you know what this is? This is probably, you probably just have like a little like irritation in your ducts, and it's probably nothing. I don't think you need a mammogram. And that made me uncomfortable. And I said, maybe we'll just get one just in case, right?
Yeah.
I'm 39 at the time. I had no family history of breast cancer. And so I was just like, well, let's just get one, whatever. So a few days later, I'm driving for this mammogram. It's like 7:30 in the morning. I didn't even eat breakfast. Not because I am going in thinking like, this is nothing. I was supposed to go to clinic after, or at least, virtually, whatever, because we're still in the pandemic. And I remember thinking while driving in to the clinic, it was dark, it was December. And I remember I had this split second moment, and I remember it distinctly. I remember exactly where it was. And I said, what if this is like one of those moments where it's like the first day of the rest of your life? It was a split second, and it was like fleeting, because it was kind of like, what if I do have, what if this is the thing? I wasn't even really worried about it, because I really it wasn't on my radar. So, but I did have that moment. And then from there, go in, get the mammogram, and this mammogram, I'm getting the mammogram done, and what I'm seeing is blood pooling on the table. And all of a sudden I'm like, that is not good. That's not good. Now I'm worried. Right.
Yep.
And so we get done with that first mammogram, and I remember the technician, she brings me to the waiting room. There's only, we had to sit on opposite sides of the waiting room with a mask on, and there's one, lady sitting down there too, but it's just the two of us. And the technician offers me a blanket out of the blanket warmer. And I'm like, yeah, sure. Okay, that's fine. I'll take a blanket. And she comes in and she's like, we need to do another mammogram. We saw something concerning. Now I'm starting to freak out. Now I'm texting everyone I know, freaking out, right? I go in for another mammogram. Same thing happens. I'm bleeding all over the place. Now I'm certain I have cancer, basically, is what I have in my head. Go back to the waiting room. Now I start crying. And I remember the one woman in the other corner is just looking at me, like probably knowing what's happening. I don't know her story, but we were alone and together at the same time. And then come back in. You need an ultrasound. And this time the physician comes in, right? And I'm like, well, shit. Yeah. and I remember he's doing it, and he puts his hand on my shoulder, and I just remember saying, like, how bad is it? Mm-hmm. And he said, let's just hope that it hasn't spread. And that response really took the wind out of me, because I was like, I didn't think you could diagnose cancer from like an ultrasound. Maybe I'm wrong. But at that point, I thought I was dying, right? Because I think it was somewhere between, it was invasive ductal cancer, and it was something, I was showing up as like an 11 to 13 centimeter tumor. Wow. I didn't know what any of these things meant at the time, like things are just swimming through my head. But I remember just thinking, like, I thought you needed a biopsy to diagnose cancer. And so then the next moment, I remember, of course, I'm texting everybody. I'm by myself, right? Because in the middle of, and so I was like, can my husband come up here? I'm not even crying or anything yet. But I remember when I started crying, I'm getting ready. And I think I walk out of, the changing room, and this older woman just looks at me. And I think by that time, maybe I had started crying. I can't remember, but she looks at me and she said, "What are you doing here? You're too young to be here," or something like that. And then I felt the same way. I felt the same way. Right. And my husband got there and just hugged me. And then I don't know what people were saying to me, telling me next steps, but clearly I don't remember any of those things. I've spent too much time in this detail, but so yeah, that was diagnosis. A few days later, they confirmed the diagnosis as it eventually shook out to be basically late stage 2 cancer. There was a scare in there that they thought it might be inflammatory breast cancer, which I thought, and this was all happening right around, Christmas. And that it was just such a terrible time. When I had left after I got diagnosed that day, it's a 10-minute drive from the hospital, and I had to pull over in a parking lot because my girls were home and I couldn't see my girls. I didn't know what I wanted to say. It was too much. So a friend came and met me, and we stood outside in the cold just crying. She has 2 daughters, and it was just like a devastating moment. And then going through all of that with Christmas, thinking, when I thought I might have inflammatory breast cancer, I was thinking, is this my last Christmas? My daughters at the time, I think, were like, I don't know, 3 and 6 or something, like too young to understand what was happening. And so yeah, that's what happened. I ended up, I did a single mastectomy right after Christmas. And then I did, I don't remember how many rounds of radiation that spring. Actually didn't, my oncotype wasn't such that I needed chemotherapy. I thought I was going to need the kitchen sink at first, but we pivoted there after I got a second opinion. I got my second opinion, I think it was on New Year's Eve. They squeezed me in kind of like on New Year's Eve. So all of that was just like was really overwhelming, was really kind of tragic with my daughters and kind of experiencing all of that. That's my cancer story. I think that's how it's coming out this time, I guess.
Yeah.
So how have things been since then?
Wow. Since then, it's a little surreal. Like it's been, almost 5 full years now. And I think people don't talk enough about the aftermath of cancer, at least not, the general public doesn't know. Yep. It's almost like you hear a lot like, oh, thank God you're okay, right? Or you're cancer free. And I think any cancer survivor knows that it haunts you and it lurks around. Like I still have kind of like a neurotic fear of recurrence. Being that I was really caught off guard. My therapist actually explains it as a trauma. It was a traumatic experience that happened of being completely, smacked in the face with a reality that came out of nowhere. And survivorship is a constant wondering. If is it going to come back? How will I know? How do I know if it's going to come back? Am I, if I drink too much alcohol, if I worry too much, if my sleep is too off, what's going to be the thing that brings it back? What did I do wrong the first time around? Am I still doing that thing? Right. And I'm a organic overthinker. And so my head gets into those spaces sometimes. And the survivorship still is, I'm on monthly Lupron and daily anastrozole. So every night my alarm goes off at 10 o'clock just so I don't forget to take my anastrozole, but I never do. I don't need that alarm. I take it at 9:55 every night because it's that important. But every month getting that Lupron shot is, hey, here's your cancer. Here it was. You're not cancer free. You're not living a life where you don't know cancer anymore. And I do think it's better, right? I think it's gotten better since I've gotten further and further out from cancer. But I think that the aftermath of cancer is still really pretty traumatic and still takes a lot. I mean, I go to therapy. I do all the self-care things just to make sure that I stay in a good headspace.
Yeah, that's good. Yeah. I can tell you, so I was diagnosed the first time at 26. I told you earlier I'm 52 now, so half a life ago. And everyone's different. I would say, generally speaking, it does get better over time, but it never goes away. And then I get smacked in the face with a second diagnosis a couple years ago, and so I get to deal with that BS now. But I think the only thing I would say is everything that's going through your head now is on par. I think I like the attitude, though. The attitude of, okay, this doesn't define me. You did mention, okay, this is the first day of the rest of my life. Mm-hmm. How would you describe that now? I mean, maybe you just did, but what is your outlook now?
Most days I am really grateful for cancer, as messed up as that might sound. Yeah. I am a different person a lot of times, that I don't have the space to sweat the small stuff. Mm-hmm. I'm alive. I am getting to be the mother to the girls that, well, I still have my hard days. I'm the best mother I can be. Let's put it there. And I'm the assistant kickball coach to my daughter's kickball team. Nice. And I'm going to soccer games, and that is not to be understated. It has allowed me to set boundaries, like in work, that like, no, I'm done at 5. I have 1 million things to do, but I'm done at 5 because I want to be present. I think cancer gave me the slap in the face that I needed to be present for the right reasons, and to really solidify, show up for the people who need you and be the type of person that you want to be more of the time, as much as possible. And I am grateful to cancer for that perspective. And I'm not sure that I could get that sort of perspective any other way.
Mm-hmm. Yep, yeah, that's fair. Well said.
Well said. Yeah.
Well, I'll tell you, we thank you for sharing that story.
Yeah.
We thank you for doing what you're doing for the community today. I've been told you've been to a few of the An Evening with Heroes galas. Is that correct? So thank you for attending those.
Yep.
We hope you guys had a good time. We appreciate your support. I think the only way we continue to try to kick this disease in the whatever, pick a body part that you want, is by working together. I mean, whether we like it or not, this community of cancer survivors continues to grow. Mm-hmm. Hopefully it grows because more people are surviving. But if we all kind of get together and work together, we can help this community out. You're very community centered. So, we hope that you'll remain part of the Heroes Foundation family and will join us in our battle and do what we can to unite Indiana against cancer.
Yeah, I really appreciate the opportunity to tell my story, and absolutely, I'll definitely keep supporting the Heroes Foundation. I love the work that you all do.
Well, thank you. We appreciate that.
Thank you.
Jasmine, have a great day. We appreciate you joining us, taking the time out of your busy day and taking off one of the 20 hats to sit down with us for a little bit.
Thank you so much for having me.
You're welcome. And thank all you guys for joining us on this episode of the Summits Podcast. We appreciate all of you taking time out of your day to join us, to listen to Jasmine's story. If you have any words of encouragement or any other input you want to put in there, throw it in the comment section. We would greatly appreciate it. Don't forget, hit that subscribe button, hit that notification bell icon. We appreciate your support. And don't forget, at the end of the day, beat cancer.